Hello Frontline Teach, this is Val. Again, I would like to spend some time talking about CD4 results that you might see on lab work. This is part 3 of the CD4 and viral load video overview. So what we have in front of us here is a lymphocyte subset report as part of the CBC differential. CBC stands for complete blood count, and so this is a count that looks at all of the various immune system cells and other components of the blood. So we have white blood cells, red blood cells, hemoglobin, other components that we'll cover at a later time. The important thing that concerns CD4 cells is down here, the lymphocyte subset profile. And so this contains two important pieces of information. First, I lost my cursor. Here we go. Percentage CD4 helper and absolute CD4 helper. That's what those are shorthand for. And the results that we have here, percentage CD4 T helper, 5%, and absolute CD4 T helper, 148. So when we're looking at this, we want to look at the number. The L indicates in this box that it's out of range and that it's on the low end of normal. If the results were within range, they would be in this box. This column is the reference range, and so this is what's considered normal, and here this is the range of normal, quote unquote, for percentage of CD4s and absolute CD4s, and then this is the units that are relevant. So we'll look at this again before we're over, but what this piece of the lesson will do is talk about what's the absolute count and what's the percentage count. What are we really looking at when we're looking at that? So, lab result, CD4 count, also known as CD4 absolute count, T cell count, helper count. The question being, how many CD4 type lymphocytes are present in that milliliter of blood? We draw a tube of blood out, it's about a tablespoon of blood, and this test literally counts all the CD4 types in that. So in an HIV negative adult, the normal range is between 5 to 1500. So that's quite a wide range. On that lab result that we were looking at before, they mark it as 423 to 1724, right? Roughly 5 to 1500. Each laboratory that does these tests is going to have a different reference range, so we use the shorthand of 500 to 1500. And on average, we know that someone with HIV who isn't on treatment loses somewhere between 50 to 100 CD4 a year, but we never know exactly where someone starts. If someone started before they were HIV positive, they started at about 500, then, and lose between 50 to 100 a year, then let's say they lose 100 a year, then they have 3 years before they fall to what's considered the AIDS diagnosis. But if someone starts at 1500 and loses 100 CD4 a year, then they have 12 years before they fall to that AIDS diagnosis range. So this is to say there are some things that we know, but the normal range is so varied that it's hard to tell where someone started. We also want to look at the percentage that was shortened as PCT, right? Your percentage, or T cell percentage. And this result talks about, out of all of the white blood cells, how many are the CD4 kind? What percentage of all the white blood cells are the CD4 kind? Again, here's the normal percentage range. In an HIV negative adult, percentage range is 32% to 68%, which is a huge range. That's basically out of all CD4, out of all white blood cells, between 1 in 3 to 2 in 3 are CD4 type. So that's a huge range, but you should understand that CD4s make up a huge component of the immune system. And results of the percentage fluctuate less than CD4 absolute count results, the trend over time is more stable. So this is something that we look at because it's less likely to change. And if it does change, that means that the overall immune system is changing and more CD4s are being depleted. So let's look at this test tube of blood. This is a tablespoon. When we want to do the CD4 count or the absolute count, we want to see how many CD4 type immune system cells we can find. When we look at the percentage, we want to count all of the immune system cells and figure out what percentage are the CD4 type cells. So if all immune system cells are 100, in this tablespoon of blood we find 100 immune system cells, that would be this whole pie, right? And if we count CD4 type cells as 25, that would be that piece of the pie. So 25 over 100 is 25 CD4 percentage. So that result would be on the low end of normal. It would be below the 32 to 68 of quote-unquote normal reference range. So the CD4 percentage definitely affects treatment decisions. If someone's CD4 percentage is 15% or lower, then they might be at risk for PCP, pneumocystis pneumonia, which is a very common opportunistic infection. And they are at risk of that if their CD4 percentage is 15 or lower, no matter what their absolute CD4 count is. I have seen folks who had a CD4 percentage below 15 who had more than 400 CD4 cells in the absolute count, and they got sick from PCP. So the treatment recommendation for them is to be on preventative therapy against PCP so they don't develop it, even if they don't have symptoms. And that's what we call prophylactic therapy or preventative therapy. We'll be talking more about that when we talk about opportunistic infections. But what you should know is that a CD4 percentage of 15% or lower can put someone at risk for OIs no matter what their absolute CD4 count is. There are a couple other lab results related to the immune system that I want to talk about before we wrap this up. CD8 count, also known as the CD8 absolute count. This counts the suppressor or the killer cells that we talked about in an earlier lesson. This is often higher in people with HIV because there's a lot of infectious material around to kill. And a normal range, again in an HIV negative person, is anywhere between 150 to 1,000 of these cells per tablespoon of blood, per cubic milliliter. So again, that's a huge reference range, and there's no... what's considered normal is a really big number. So this is often higher in people with HIV, higher than 1,000 per milliliter. We also might look at the T-cell ratio, and this is the absolute CD4 count divided by the absolute CD8 count. So we're sort of comparing these two crucial groups of immune system cells, and a normal ratio is between 0.9 to 6, but it might be lower in people with HIV. That's one of the things that we want to look at, but it doesn't have specific treatment recommendations. It's just one of these things that lets us know how the immune system is doing. Next up is the video on viral load test results. I'll see you there.